Hello, I'm Dr. Edgar Guarin, Dr. G for short. I am a family physician, fellow of the American Academy of Family Physicians. I am the only dedicated vasectomy surgeon in the state of Iowa, and I am fully committed to the promotion of vasectomy as the safest and most cost-effective procedure of permanent sterilization. I'm convinced that a vasectomy empowers men, women, and families. This is a presentation of the SimpleVas vasectomy technique. A vasectomy is a very simple surgical procedure performed in men and families who have decided to have no more children or any children at all. It involves the interruption of the transfer of sperm into the semen by cutting the communication between the testicles and the rest of the genital system. It is performed in the medical office under just local anesthesia. Let us start by reviewing briefly the male anatomy. This is what we call a sagittal plane, which offers a view of the body as if it were cut in two halves, left and right. From that view, this is how the male genitourinary system will look like. Normally, the testicles will produce sperm capable of causing a pregnancy. Then the sperm is transported through the vas deferens. The seminal vesicles and the prostate provide nourishment for the sperm, accounting for 95% of the amount of semen. Finally, during ejaculation, the semen comes out through the urethra in the penis. After a vasectomy, there will be no changes with erection or hormone levels. Your strength, stamina, and sexual desire will continue to be the same. After a vasectomy, your sperm is reabsorbed and recycled by your body inside with no harm to you. Proper anesthesia provides adequate pain control during the procedure. It allows for a better experience for the patient and would also allow the patient to recover faster from the surgery. The local anesthetic can be administered using a needle or not using a needle by an alternative method. Let's talk about the use of needles for local anesthesia. There are multiple sizes of needles, but in the case of a vasectomy, a very thin needle is used. Usually a 30-gauge needle, as those used by diabetic patients, is sufficient to administer the local anesthetic. This technique is the one that most vasectomy surgeons regularly use. There is a minimal entry wound when the skin is injected, and usually patients report a squeezing sensation at the time of the injection. During the SimpleVas vasectomy technique, no needles are used for the administration of the anesthetic. Instead, a pressure spray applicator called MadeJet is used. This device uses a pressure stream of anesthetic that goes through the skin with minimal injury. There is an immediate anesthesia of the skin and the underlying vas, allowing for a more comfortable procedure. Patients usually report the sensation of a small flick over the area of application right on the skin. Once the anesthesia has been administered, then the procedure begins. It is important for you to know how this procedure is done so that there's clarity about what to expect after the completion of the surgery. Let us review the two techniques used for the completion of a vasectomy. In the traditional vasectomy method, a scalpel is used to enter the skin of the scrotum. Using a scalpel requires the placement of sutures to close the wound at the end. With the no-scalpel technique, the approach is different. The no-scalpel technique has been used in the United States since the 1990s, but has been available since the late 70s, initial 1980s, after it was invented by Dr. Li in China. First, a central opening is made with a sharp, pointy instrument on the skin. This is the instrument. Then, using a special ring-shaped clamp, the skin anesthetized and the underlying vas are held and lifted through a very small opening. With this technique, there's no need for sutures at the completion of the surgery. Now, once the vas deferens is taken out of the scrotum, there are different techniques to interrupt the transport of sperm. It is important to know what technique your surgeon uses, as this will determine how effective the procedure will be. There are different methods to block the vas, with different rates of success. With them, sutures or titanium clips can be used. In some cases, the inside of the vas is cauterized. We would refer that to MC for the diagram. In some cases, one side of the vas will be covered with the surrounding tissue. We would call this fascial interposition, or FI. These are examples of the different blocking techniques according to the American Urological Association. With this technique, both segments of the vas are tied with sutures. Unfortunately, this can lead to a failure rate of slightly over 13%, meaning that 13 out of 100 men having this blockage will get their partners pregnant. This is not acceptable. In this other technique, a similar approach is taken, but instead clips have been used. The failure rate is slightly better, but still unacceptable at a little over 8%. Here, the dotted line in this diagram represents covering the upper portion of the vas after being cut with the tissue around it, with the failure rate, in this case, dropping to about 6%. It is much better, but still unacceptable. On this other technique, when the cauterization is used inside both segments of the vas after cutting it, the failure rate comes considerably lower to less than 0.6%. With this technique, there are no sutures or clips applied. Now, if in addition to cauterizing the segments, the upper portion is covered, then the failure rate goes to less than 0.55%. Finally, if only the upper portion is cauterized and then covered, the failure rate is much better and less than 0.5%. This is what I do with simple vas. So in summary, during a simple vas vasectomy, first, the anesthesia is given with a pressure spray applicator. Second, I don't use a scalpel. Third, I cauterize one end of the segments, cover it, and seal it with sutures. After your vasectomy, follow the postoperative instructions strictly to avoid complications. Make sure that you have minimal physical activity for the first 24 to 48 hours. If you have any discomfort, you may take the medications provided to you in the package that was sent to you already. You can use ice during the first 4 hours after the procedure, applying it for 30 minutes and removing it then for 30 minutes alternatively. Make sure that the surgical wound is always dry. On the morning after the procedure, take a shower and remove the dressing of the surgical site. Make sure that you wear the scrotal support for at least the first 48 hours. And avoid aggressive sports for about 1 week. You may resume sexual activity within 5 to 7 days after the surgery. It is not uncommon to have some blood in the semen. This will be normal. The vasectomy is not effective immediately. Therefore, after 12 weeks and 20 ejaculations, a semen sample should be checked to confirm sterility. Follow the instructions given for the submission of your sample. Remember that a vasectomy will not protect you against sexually transmitted diseases, so continue with safe sex practices. This is a very simple procedure with a very low rate of complications, but at the end, it is a surgical procedure and you need to observe properly any instructions given. A vasectomy is appropriate for someone who desires a permanent method of contraception. If you think you're not ready for this, there are alternatives that you can use. You may choose hormonal methods for your partner like pills, patches, or injections. This will leave on your partner the responsibility of contraception. An alternative is the use of an intrauterine device, or IUD, which is a small device inside the uterus of your partner to help with contraception for 5 to 10 years. The use of spermicides, although not as effective, can also be considered. Barrier methods like condoms are also an alternative, with the added benefit of protection against sexually transmitted diseases. If you fail to use any method of contraception, you can always use the morning after pill. This is known as emergency contraception. Finally, an alternative to vasectomy could be the use of a surgery like a tubal ligation for your partner. However, this will bring more risk due to the need for general anesthesia and a trip to the operating room. If you think that you don't want to have any more children, or if you just don't want to have any children at all, vasectomy is an excellent option. However, you must remember that a vasectomy is a permanent decision. Even though reversals of vasectomies are possible, the success rates are variable and they're very costly. An alternative to reversal is sperm storage. This might be a good option for those who want to have a vasectomy and have not fathered any children yet. This carries a cost and is not always successful. Remember that a vasectomy is a permanent decision. But in your decision-making process, consider the fact that having children is also a permanent decision. If you're to make the decision, make sure that you complete your registration available in our website. If you have any additional questions, please give us a call. We will be happy to clarify any concerns prior to the surgery.